Hi, good evening, everyone. Thank you for joining us for today's webinar on fatty liver. My name is Dr. Mike Mills, and I'll be going through some aspects of fatty liver. I know it's a condition which perhaps everyone has come across more and more over the last few years. Certainly, when I was in medical school, fatty liver was not something which we focused on. And even up to recently, physicians maybe would not have been paying much attention to fatty liver, even though it would be diagnosed more and more. So we're going to spend a few minutes talking about fatty liver. We'll give enough time for questions and answers. If you have anything that you'd like to have clarified, you can always type your questions in the question and answer section, and then we will go through those. Unfortunately, we'll not be able to unmute your microphones, but we should still have a fairly interactive session. So I'll stop at any time when any questions come up to allow us to discuss fatty liver. So this topic is fatty liver. What now? Treatments, myths, prevention. Our objectives are to look at fatty liver. What is it? What causes non-alcoholic fatty liver disease? What's the significance of this condition? What are the symptoms of fatty liver disease? What tests are needed to consider the condition? And ultimately, what treatments are available since we want to study this condition. First thing to recognize is that fatty liver is actually very common, and this pictorial representation really just highlights the fact that non-alcoholic fatty liver disease, or NAFLD as it's shortened to, has a prevalence worldwide of approximately 30%. So that's a significant number if you think about it. Almost 1 in 3 individuals worldwide would have some degree of fat in the liver. The highest prevalences are in North America. So you see here in red the North American situation. Western Europe, 25%. Latin America, very high, depending on what kind of research you're looking at, anywhere from 30 to 60% of individuals. South Asia, 22 to 46%. East Asia, so very worldwide prevalence. We don't have figures, unfortunately, from the sub-Saharan African region. We do have some figures from Jamaica, but unfortunately these are not prevalence figures. They're actually ultrasound figures looking at prevalence, and we'll speak about that as we move on. But just broadly speaking, fatty liver is an emerging global health issue affecting approximately 20 to 30% of individuals. This does highlight again that the prevalence has been increasing over time. And we see here at the time when fatty liver was being looked at from the 1990s to 2000s early, the prevalence was approximately 25% globally and has been increasing over time. And this is largely matched by an increased prevalence of obesity and type 2 diabetes. So as these two conditions increase, the prevalence of fatty liver, or how frequently we see fatty liver in our populations, has also increased. The prevalence in type 2 diabetes is something to look at. So individuals who are diabetic, type 2 diabetes, definitely the risk for fatty liver in diabetics is approximately 55%. And if you were to do sampling, meaning if you were to biopsy the liver in someone who's diabetic, you'd actually find more cases than are being reported by just doing non-invasive or non-biopsy testing. So as high as almost 2/3 of individuals with type 2 diabetes will have some amount of fat in the liver. When we speak about fibrosis, so looking at this last point here, we're talking about scarring in the liver, and approximately 17% of patients with type 2 diabetes have some amount of scarring, and this is a significant thing. But before we jump into fatty liver, we want to make sure everyone is on the same page, so we want to just review what is the liver. Pretty basic question, but still something that we need to be sure that everyone is, on the same page. This painting here represents Prometheus, and if you know the story of Prometheus, he was one of the titans in the Greek mythology, and the father of the god Zeus basically punished Prometheus because Prometheus was the one who stole fire from the gods and gave it to man, and his punishment was as depicted here, to be chained to a rock, and every day one of the eagles would come and eat Prometheus's liver, and overnight the liver would regenerate or would grow back, and then the cycle would repeat. The eagle would come back and eat his liver, and then it would regenerate. So this is highlighting the fact that the liver is actually, first of all, the largest solid organ in the body, heaviest organ as well, single organ. It's a single organ shaped like a triangle, located on the right side just below the breastbone, and it has a remarkable ability to regenerate. So if you remove part of your liver, it will grow back completely as long as it's a healthy liver and you're also healthy. So this ability to regenerate is something that is taken advantage of when we look at liver transplantation, for example. So you can donate part of your liver to someone because it will regenerate. This highlights the fact that the liver is very well supplied by blood vessels. So it's basically showing you that the liver is divided into different segments, and each one is supplied by an extensive network of blood vessels. And this is important because this helps the liver to maintain health and to function somewhat independently. So each of these little subunits can be removed once you know what the blood supply is. There's some other structures which are intimately related to the liver, like your gallbladder and your bile duct. So all of these helped the liver to fulfill its function. So the first question that we want to maybe think about is, what is the liver involved in? What is the liver involved in handling for the body? Glucose, proteins, cholesterol, vitamin B. If you were to choose which one it does not handle, the answer here will be vitamin B. So vitamin B12 is not handled by the liver, but it does handle glucose, proteins, cholesterol, and other molecules. And that's because there's an extensive connection between your liver, which is in red, and is connected to your digestive system. So when you eat things, and never mind my poor representation of a cartoon here, but this is your stomach leading into your small intestine. And when you eat and your food is digested in your small intestine, the nutrients get absorbed into your bloodstream, and that goes straight to the liver, where the liver has a function to process everything. All the nutrients are handled and changed, and then it is released into the blood to the different areas in the body for different functions. So there's a connection between your digestive system, your liver, and the rest of your body. So the liver has multiple functions, however. Too many to go through in this presentation. So the ones that we want to focus on are making and releasing bile. So the liver is important in digesting fats, so that's where bile comes in. It makes bile, the liver makes proteins, the liver makes cholesterol. So even though cholesterol is thought to be a quote-unquote bad thing, the liver actually makes cholesterol, and the body needs cholesterol to carry out functioning of nerves and blood vessels and other structures. It stores glucose, so the liver actually helps to store excess glucose by changing it to glycogen. It stores iron, so if you eat a lot of iron-rich products, the body needs it for blood, but it also stores the excess inside the liver. The liver helps detoxify, so one of the common things is that people know, oh, your liver is helping to detoxify. So it detoxifies drugs and it detoxifies any poisons. It clears the blood of medication, so most medications that you take have to be broken down by the liver and then passed out by the kidney. It helps blood to clot normally, so it makes proteins which help in blood clotting, and it helps your immune system. So healthy liver contributes to a healthy immune system. So all of these are basic functions of your liver, which of course you would want to have working, and you don't want anything to impair the function. So let's go back to the liver and digestion. So we said that the liver is related to your stomach, which is over here, your small intestine, your pancreas, which produces insulin and enzymes, which releases the enzymes into your digestive tract to break down food, your stomach, which produces acid, which also helps to break down proteins, and then the liver over here, the triangular shaped structure, which produces bile, which it stores in the gallbladder, and then releases into your intestine. So all of this digestive system helps to process glucose, fat, protein, and then fiber, which ultimately is not absorbed and passes out in your colon. So the liver helps then to regulate energy stores because the body needs energy to work in the form of what we call ATP, which is a form of a basic molecule which all your cells need to function. So the liver gets, or your cells get ATP, which is your basic energy unit, from glucose, so the sugar, which comes from your diet. But if you have too much sugar or too much glucose in your diet, the liver will see that and it will change it to glycogen and it will store it. So this excess stored energy can also be stored in other forms inside the body. The glycogen is a kind of a short-term storage for glucose, but if you continue to accumulate this excess energy, it will transform all of this extra sugar into fat, or in your adipose tissue, which is your fatty tissue. So when your body needs this extra energy, it gets energy in this sequence. First from glucose. So if you need it right away, if you have glucose available, your body will use glucose. Then your body, if it doesn't have any glucose and it needs more energy, it starts to break down fat, which is why exercise is so good, because you can break down fat to convert it to glucose for energy. If you break down all your fat, your body is going to start breaking down protein, which is why you need to have adequate stores before you do exercise, because you can start to break down protein, which is then formed into energy. So the more you eat carbohydrates, the more your body will store it as glycogen and fat unless you use it. And that's important to recognize. So the liver can store adipose tissue, which is this fat which accumulates inside the liver cells, can also get fatty, and this is where the problem lies. So when the fat is stored inside the liver cell, then that's a problem, and we refer to it as fatty liver. So there are different causes of fat in the liver. Most times when you have fat in the liver, we ask about alcohol, because alcohol, excess consumption, can cause fat in the liver. Pregnancy can cause fat in the liver. There are certain medications which can cause fat to accumulate in the liver. And then there's this condition which we're focusing on today, which is called non-alcoholic fatty liver disease. So any individual who does not consume a lot of alcohol, who has fat in the liver, is not pregnant, not taking medications, we say they have non-alcoholic fatty liver disease. So you'd want to say, then what is a safe level of alcohol then? So it's not the same for men and women, so there are different amounts. For women, we allow less than 2 drinks per day. For men, less than 4 drinks is definitely too many drinks already. So less than 2 drinks for males and females would be acceptable. However, in females or in smaller individuals or certain genetic predispositions, we even say that less than 1 drink per day is acceptable. There is some recent information suggesting that there's no safe level of alcohol consumption, but this is very controversial. We would recommend, however, that less than 2 drinks per day would be considered to be not significant for fatty liver. So these are the terms we want to be familiar with: non-alcoholic fatty liver disease, or NAFLD, which is NAFLD. Then there's non-alcoholic steatohepatitis, which you may see, which is NASH. Whenever we speak about steato, so we already say non-alcoholic, so someone who does not take alcohol, who has fat, which we refer to as steatosis, and has hepatitis, so now they have inflammation inside the liver. So when there's inflammation, then we call it NASH, which is a more severe form, or just simply fatty liver. How do we know then when fat gets into the liver? Well, it's not obvious. So most times when there's fat in the liver, there's no obvious way of knowing. You may have some discomfort in the area of the liver, which we said was on the right side, just below the breastbone. But for the most part, you're not going to have any symptoms. So individuals will be walking around with fat in the liver without actually knowing about it. So how then do we find out if there is fat in your liver. Examining the abdomen, that's not a good way. We may find that the liver is enlarged, but it's not possible to find out if it's from fat. Doing a blood test, again, not a good way of figuring out if there's fat. Doing an ultrasound is a fairly good way of figuring out if there's fat in the liver. Talking to the patient is not enough. So of all these ways to figure out if there's fat in the liver, most individuals would have known because they did an ultrasound. Sometimes a blood test can show inflammation in the liver, and that would cause us to go searching for other causes of inflammation. But for the most part, to diagnose fat in the liver, you need to do an ultrasound because your examination is probably going to be normal and your blood test may also be normal. So what does the ultrasound show really? So this is what the liver looks like on ultrasound. So you can only see a part of it on any one ultrasound image because the ultrasound probe can't show the whole liver, but you see glimpses of this triangular shaped structure. So this is a normal liver, and then the fatty liver, which is on the right side here, is basically a little bit grayer than the normal liver. So this gray, more shiny appearance is due to the fat in the liver. So that's how we can tell that there's some fat there, because the two livers look a little different. Okay. The ultrasound, however, doesn't show all cases, only about 60% of cases. So you can still miss fat in the liver if the ultrasound is normal. So it's not 100% sensitive. If there's some inflammation in the liver associated with it, which you said was NASH or non-alcoholic steatohepatitis or inflammation, then the ultrasound may pick up a little more in terms of the amount of fat, but it may not be sensitive enough. So the effect of fat on the liver then. So we can find when it's there, we know that it could be doing nothing. So the fat could be in the liver and has no effect at all. So your liver is quite healthy, you are quite healthy, but we still know that you have a condition called non-alcoholic fatty liver disease. Or you could have fat in the liver which causes inflammation or hepatitis, and this is a problem because once there's inflammation, the liver is going to try and heal itself, and if it has ongoing inflammation, it may heal with scarring or cirrhosis, and this is a problem. So we're trying to prevent inflammation and we're trying to prevent scarring in the liver in a patient who has fat. Even though we know most cases, if you have fat in the liver, there will not be inflammation. So what is the natural history? In other words, what happens when we just follow a patient who has fat in the liver to completion without doing anything at all? Well, it's difficult to predict what's going to happen. So the normal liver, as represented here on the extreme on the left, if you have fat in the liver, which is non-alcoholic fatty liver disease, in this population, which is most people, you may not see any effect on the blood test or any effect on the liver in terms of damage. However, it can progress to non-alcoholic steatohepatitis, which is inflammation of the liver, and at that point the liver blood test may be abnormal and you may be at risk for scarring or fibrosis, and that can progress to cirrhosis, which is a bad form of scarring or fibrosis. And the problem with cirrhosis is that it can lead to liver cancer. So it is possible to develop scarring or cirrhosis, just like when you drink too much alcohol, when you have cirrhosis of the liver, and that can cause complications of cancer of the liver or liver failure in itself. Now, the rate at which individuals with fat in the liver go on to have scarring or cancer is very low. So only 2.3% of people every year who have fat may go on to these extreme forms, but the problem is you won't know who is at risk unless you do some kind of testing, and you certainly don't want to do nothing. You want to try and prevent the complications and even reverse the condition. And you can see here that these arrows that I put here are bidirectional. So if you have a normal liver which has fat in it, it can go right back to normal if you take steps. If you have a liver that has fat and there's some inflammation, if you take steps to address it, it can go all the way back to just fat alone with no inflammation, and even all the way back to normal. But once there is scarring inside the liver, unfortunately, it is very difficult. It may not be impossible, but supremely difficult to get it to go all the way back to normal, because scar tissue, once it sets in, it is difficult to get rid of, and that's where the complications arise. So you want to prevent scarring. Liver is not the only problem with fatty liver, though. There are some other problems which are associated with fatty liver outside the liver. And this is also why fatty liver is becoming more and more important to pay attention to, because once you have fatty liver, it means you are at risk for some other medical conditions, and you need to pay attention to what these other medical problems are, because they have significant implications. Diabetes. So type 2 diabetes, we already spoke about initially, to say that individuals with type 2 diabetes are at higher risk for fatty liver, and the other way around as well, because they go together. So type 2 diabetes is very common in our population, and fatty liver is something that is associated with type 2 diabetes. Cerebrovascular disease or stroke, also an increased prevalence in individuals who have fatty liver. So you want to reduce your risk of stroke. Heart attack or cardiovascular disease, so these are all lifestyle-related, non-communicable chronic diseases, which also have increased risk in individuals who have fatty liver. Sleep apnea. So sleep apnea is a condition where individuals have their breath stopping basically during sleep, and sometimes they have daytime sleepiness, and snoring can be associated with being overweight or obese. And this mask is something that anyone who has sleep apnea will be familiar with. So a CPAP machine, which is worn at night to help with their breathing, is strongly associated with fatty liver as well as obesity. Cancer. So fatty liver increases your risk not just for liver cancer, but cancers generally, because of the risk associated with obesity and fatty liver. So cancer is not just breast, colon, stomach, but other cancers have an increased prevalence in fatty liver. So you can see that fatty liver itself is not to be ignored, because it really signals that there is something wrong with your metabolism. And it's associated predominantly with something called too much insulin resistance. So insulin, as we spoke about before, is coming from your pancreas, and as you know, it's related to diabetes. So if you don't have proper insulin health, then type 2 diabetes can be a problem. And when you have insulin resistance, so your body is not seeing the insulin that is there, it's resistant to insulin, then you have diabetes. Hypertension is another condition which is associated with insulin resistance, and also obesity. So these things together are what are called metabolic syndrome. So when you have this profile, your risk goes up very dramatically for all those lifestyle-related conditions we spoke about. And fatty liver is associated with this metabolic syndrome. So as your weight increases, your risk increases, even though you can have fatty liver in a normal weight or normal BMI individual. So even though most people will have fatty liver when they're overweight to obese, even if you're normal, you could still have fat in the liver, and that needs to be assessed, because you want to prevent the progression from normal to fat to scarring to cirrhosis to cancer. So you want to intervene at the early stages where it is reversible, and this is where it's very important. So that leads us to treatment then. What are your goals of treatment? The first thing is you want to decrease inflammation. So the hepatitis part is what you want to limit or reverse. You want to target liver scarring, so you want to prevent that. If it's there already, you want to stop it. And if possible, even though not likely, you want to reverse it, because you want to prevent cirrhosis, which is one of the end stages of your liver health, and the complications of liver failure and liver cancer. So essentially, these are the goals when we talk about how do we treat fatty liver. So the first thing we want to do, first-line therapy, first-line treatment, you want to reduce your caloric intake. So we already spoke about having too many calories and what happens to your extra glucose and extra fat stores that the liver will take on. So you want to reduce that so that you don't have so much to store. Then you want to target weight loss and exercise. So reducing your caloric intake will reduce fat in the liver, which is steatosis, and it will also improve your insulin resistance. So it has benefits outside of just the liver. It doesn't matter how you reduce or restrict your calories, however. So there are a number of diets available, and to go through that sometimes is difficult because individuals want to know, oh, so can I get a diet sheet to work on? What do we eat? There's so many different approaches, and the good thing is that they've mostly been studied to see what the effect is on not just fatty liver, but also diabetes, obesity, hypertension. The different types of manipulations of what we call macronutrients, so proteins, lipids, or fats, and carbohydrates have been studied. Whether you do Atkins diet, ketogenic diet, paleo diet, Mediterranean diet, whether you do periodic fasting, where basically you take a certain amount of time and say, okay, I'm not going to eat for X number of days. I'm only going to have water or cabbage juice or whatever it is. Whether you do time restricted feeding, so you say, okay, I'm going to have all my meals only before 6 o'clock in the evening, nothing after 6 p.m. Whether you do alternate day fasting, whether you restrict specific food groups, so whether you vary and have less protein, more fat, less carbohydrate, a little more protein, more fat, less. So the different combinations, all of them have the same effect once you restrict the amount of calories in terms of improving the amount of fat in the liver. So the key takeaway from a dietary standpoint is to reduce the calorie content without paying don't pay an excess amount of attention to the components of the diet and the timing of the diet. The only thing in particular in terms of fatty liver and diet that we're especially concerned with is your high fructose corn syrup. So lots of data has shown that those individuals who have fatty liver have a much higher consumption of high fructose corn syrup. And these are found very frequently in your baked goods, in your sugar sweetened beverages. If you go to your supermarket and look at your cereals, a lot of different products have high fructose corn syrup, and unfortunately this is associated with fatty liver. And if you want to pay attention to a particular thing in your nutrition, you want to pay attention to your corn syrup consumption. So the key thing is to try and lose weight, but not by doing just a so-called weight loss diet, because you have to be able to stick to it. And part of the problem with diets is that people have difficulty with adherence. So sticking to the diet over more than 10 to 12 months is always a problem. You have to make it more a lifestyle change rather than saying I'm going to go on a short-term diet. You want to achieve negative energy balance, so definitely you want to take in less calories if you're trying to lose weight. Then you want to have high quality foods as well, so paying attention to the components of the food, making sure that you restrict things like your high fructose corn syrup intake. What about exercise? Well, exercise doesn't work in isolation, so if you're having exercise as part of your plan, or in this case improving fatty liver, it definitely will be a component, but as they say, you can't outrun a bad diet. Okay, so no amount of exercise is going to cover for you if your diet is not adjusted as well, but it definitely has its role to play in increasing your energy output. And as we know, once you are expending energy, your liver will not be storing this in the form of glycogen and ultimately fat, and this is what you're trying to work on. So exercise definitely has a role to play in conjunction with diet. Medications, despite what you may think, there are no current approved drug treatments specifically for fatty liver, and we're speaking about fatty liver in particular here now. So in the news or on social media or in other media, you may have heard about weight loss drugs, in particular Ozempic, which is the newest drug which a lot of celebrities are using for weight loss. It has a role to play in weight loss. It's not designed for weight loss, mind you. It's a diabetic drug, so it's used in individuals of type 2 diabetes. But it does cut your appetite, and so it has been used by individuals so-called off-label as a weight loss drug. This is not really what it's for. So even though individuals have been using Ozempic as a treatment for obesity. At the moment, it's actually approved for treatment of type 2 diabetes. There is no data looking at the outcomes specifically for fatty liver, but there is some early work showing that its use, once you reduce your weight, you can improve your liver health by reducing the amount of fat, but it's not going to be necessarily prescribed for that. Vitamin E, that's probably the only drug which has a little bit of data showing that doses of 800 international units per day have been shown to improve the liver histology. In other words, what does the liver look like when you take a sample of it if it has fat, but only works or should only be given in individuals who have inflammation. So if there's steatohepatitis or NASH and they're not diabetic. So if you're diabetic and you don't have a biopsy proving inflammation, then you should not be using vitamin E because there are some risks. There are risks of bladder cancer, for example. And so in that regard, most individuals would not recommend vitamin E. And as I said, there are more effective ways to improve fatty liver without using medications. So we should not be looking for medications in particular. We should be trying to focus on this treatment triangle. So the goal here is to try and improve your BMI and to try and lose weight. Now, the amount of weight you can lose is really dependent on the option that you choose, okay? If you can lose 5% of your body weight over a 12-month period, you will improve the amount of inflammation and fat in the liver. So just a 5% improvement, doesn't matter what your starting weight is, 5% change will definitely improve. The more weight you lose, the higher the percentage is, the greater the improvement in the amount of inflammation and fat in the liver. So if you can achieve, for example, if there's inflammation, we target a 10% weight loss, but only certain therapies will help you to achieve that. So it's very difficult to achieve 10% with just lifestyle. And so sometimes individuals will have medications, for example, to help them to achieve this amount of weight loss. And ultimately, if you're trying to achieve weight loss of 25% and more of body weight, which is a significant amount of body weight, it's about a quarter of your body weight, can be done on lifestyle and medication and exercise. But more and more you're seeing individuals turn to surgery. And there are different types of surgery which help in weight loss. So so-called bariatric surgery or metabolic surgery. There are three main types, and the ones that we advocate because they're safe and effective would be, just let's call them A, B, and C without getting into the names. But basically what's happening here in A, surgery A, is you're making a very small stomach. So basically what they've done here is cut the access to your stomach. So this stomach here is this bag which is attached to your esophagus. The food is supposed to come down here, enter your stomach, go down your small intestine, and then go to meet your liver and pancreas and so on and get digested. However, when you do type A surgery, which is called the Roux-en-Y bypass or the gastric bypass, you're basically bypassing the surgery. So you're taking your bowel, small bowel, and connecting it way up top of the stomach and cutting off this access to the main part of the stomach. So the food basically has a little area to rest in. So you feel full early, first of all, and then you're going to bypass some of the digestive process and basically short circuit the bowel. So individuals will lose weight by bypassing most of the stomach. So that's one way. The second way is by basically cutting off about 2/3 of the stomach. So you're doing a sleeve gastrectomy. So you're cutting off most of the stomach and you're left with just a little tiny sleeve of a stomach. So not as dramatic as the first one, but almost as effective because you now have just a tiny amount for food to enter when you swallow. Then there's the adjustable lap band. So this device is placed like an elastic band around the outside of the stomach, and it basically squeezes and forms like a tiny mini stomach so that you feel full early. You still have access to the rest of the stomach, but because food is going to sit on this elastic band first, individuals will not want to be eating as much. So by that way, you can lose weight. Of course, if you're not careful, you can stretch out this band, and so people will ultimately over time need to have this adjusted, and there's a device which you can use to adjust it and so on. So there's an adjustable lap band, for example. But these are your 3 effective ways of doing surgery. But as you can see, they are quite dramatic and drastic. So you want to prevent any of these being necessary, even though they are effective in managing patients who have not necessarily fat in the liver, but obesity, which is very severe, some morbid obesity, especially when there's associated diabetes or sleep apnea or another complication. So we see here, broadly speaking, that the more weight you can lose, whether it's 5% or 10%, the more you get improvement. So if you're talking about inflammation, if you lose 10%, you could improve up to 90% of individuals will have complete resolution. So the liver returns to normal 9 out of 10 times if you can lose up to 10% of your body weight. So this is your target, 10% weight loss. And it doesn't have to be over a short period of time. Usually allow you up to 1 year or 52 weeks of trying to get this down to target. If you can only lose 5%, there's still benefit to be had. 26% of individuals will have complete resolution, so a quarter of people. And if you have more severe disease, however, so the more severe inflammation and scarring you have, is the more weight you need to lose to get improvement. The key thing is that you have to be able to maintain the weight loss, okay? Some numbers suggest that the higher the target is the more difficult to achieve, and so it does require some strong psychological support and help and clear goals to achieve this over a long period of time. So managing the fatty liver then is basically managing your energy intake. You want to reduce your carbohydrate intake, especially those calorie dense things, processed foods, because you want to reduce fat and improve the use of the energy stores. You want to limit the glucose consumption, so simple sugars in your diet. You want to definitely cut back on that because your body will start to store glycogen and then ultimately transform that to fat stores, which ultimately end up in the liver. Because your goal is to reduce your weight gradually, targeting about 10% if there is fat in the liver in particular, especially if there's inflammation or scarring, which you need to know. And all this can be aided by exercise, but not in isolation. There's a limited role for medications. Antioxidants theoretically may have some role to play. Vitamin E only in individuals who are not diabetic and who have biopsy proven, which is not going to be many people because we don't biopsy very often. Prevention, so healthy lifestyle, having less fried foods, processed foods, carbohydrates, and sugars are the key things to pay attention to. Exercise in particular to help to improve your metabolic profile, increase your metabolism, burn more calories, reduce your fat stores, all have key roles to play in the prevention of fatty liver. You want to know if there is fatty liver, definitely an ultrasound may show that, and that's usually how most individuals will be initially diagnosed, certainly up to recently, even though you pay attention to the fact that only about 60% of individuals you'll be able to pick up the fat, all the fat in the liver with an ultrasound. So you will still necessarily potentially have fat without knowing, which means that you need more tests or other tests to determine if there's fat in the liver. And luckily we have more equipment available to diagnose fat in the liver. So a fibroscan machine is a specific type of test which can detect fat in the liver specifically. It's similar to an ultrasound using a little probe. It doesn't take more than 10 minutes to do the test to assess the amount of fat in the liver and also to assess the amount of scarring in the liver without necessarily having to do anything more. There's no biopsy involved, and it can give you an idea as to whether you have fat and whether that fat is mild, moderate, severe, whether there's any scarring, because as we know, scarring is what we're trying to look out for and prevent, because you want to prevent the complications of cirrhosis and liver cancer and liver failure, which are the primary things which we're concerned about with fat in the liver, even though we know that most individuals can reverse fat in the liver from the inflammatory state back to normal fat with no inflammation back to completely normal if you can remove the need for the liver to store fat. because we know that fatty liver is increasing worldwide. It's associated with metabolic syndrome, so obesity and diabetes in particular. We want to assess the amount of fibrosis or scarring in all our patients who have fat in the liver, because this is how we will decide which patients are at risk for scarring, which patients are at risk for liver cancer, liver failure, which ones will progress. We know that it's possible to reverse fatty liver if we can find it early, even though we know that there are no approved treatments. Lifestyle and weight loss changes to reverse the amount of fat in the liver are important. And even though we know that the future will always produce new drugs in various phases of development, at the moment, the key thing is to recognize the condition and take steps to reduce the prevalence and severity. So we're going to end there. Thank you for your attention. And if there are any questions, as I said, you can try and type them in the chat and then we will try and address them. So thank you very much for attending this evening, and we will take any questions at this time. Thank you for your question, Carrie Ann. Is my practice in Jamaica? Yes, my practice is in Jamaica. I do have a medical practice on Phoenix Avenue called Phoenix Gastroenterology. I can put the information in the chat. You can have a look at our website and make appointments where necessary. What does high bilirubin levels from blood tests mean? Okay, bilirubin, Kimberly, is something which is related to bile. So it's the way that the body processes bile, which is a breakdown products from red blood cells. So when red blood cells are natural at the end of their lifespan, the body will break them down and the liver will recover the bilirubin, which is that pigment or the colored part, especially the yellow color. The bilirubin, which you will see in your blood, will be high if it can't leave the liver and go into your intestine. So normally, the high bilirubin is high because either you're making too much, so if your blood cells are being broken down very quickly, or, so example, patients who have sickle cell disease, their red blood cells are broken down very quickly. Or if you can't get rid of the bile or bilirubin into your blood, so if it's blocked, if your bile duct is blocked up, then it will show up in the blood. So if you have gallstones, for example, sometimes if you have liver issues, then you can also end up with elevated bilirubin. So there are a number of things which can cause it to be elevated. And the key thing is that we need to assess to see what the degree of elevation is, and then figure out what's the actual cause, and then take steps to improve that if it's possible. So I hope that answers. Does prolonged use of stomach pills cause non-alcoholic fatty liver disease? And does a history of acute pancreatitis predispose you to, what am I seeing here? I'm not seeing, to the same thing. All right, so does prolonged use of stomach pills cause NAFLD? When you say stomach pills, I think you might be talking about things like proton pump inhibitors, so Nexium, pantoprazole, lansoprazole, that type of thing. Maybe you're talking about those things, but no, they're not associated with fatty liver disease at all. Does a history of acute pancreatitis predispose you to fatty liver? No, but the only thing is that pancreatitis can be associated with alcohol use, for example, and alcohol can also cause fatty liver. So it's possible that whatever is causing the pancreatitis could cause fatty liver separately, but the pancreatitis itself would not cause fatty liver. When and how do we take the decision to move to a more pharmacotherapy strategy? Victor Lee. Okay, so let's say the first thing is always going to be lifestyle and exercise. So we're going to encourage you to, if you've not made attempts before, to seriously look at the way that you're processing your nutrition. If, however, you have morbid obesity, so your doctor will calculate your BMI, and you have complications associated. So obstructive sleep apnea, for example, or uncontrolled type 2 diabetes, if you have other conditions like heart failure or anything else which may be impacted by your obesity, then definitely in that setting, you want to use some kind of more rapid means of weight loss, and this is usually where medications play a role. So it's not usually going to be in the more mild cases, it's going to be in the severe cases, especially if there is a complication or morbid obesity. Is the fatty liver that causes inflammation, or inflammation in your body that causes fatty liver? Right. So Sonia, it's definitely the fat in the liver that causes inflammation in the liver. Inflammation in your body in other areas would not cause fat to build up, even though there are other causes of inflammation in the liver outside of fatty liver. So other things can cause hepatitis, like autoimmune conditions, for example, which can cause inflammation in the liver, but it would not have anything to do with fat. So the fat itself can cause inflammation. The role of vitamin E in treatment of fatty liver, right? So as we mentioned, hopefully that was answered, but vitamin E plays a role as an antioxidant in patients, however, who have proven biopsy inflammation, proven on biopsy, and don't have type 2 diabetes, because the benefits are best seen in these individuals when you do an actual biopsy, even though the theory behind it suggests that more people may benefit. So the role is really in patients who have biopsy proven or significant amounts of inflammation and do not have type 2 diabetes. So some kind of assessment needs to be done to identify these patients, because you can do some harm by using vitamin E in high doses, which is what you need to use. I'm diabetic and did an ultrasound. I was told I had fatty liver. I have a better, okay, you're welcome, Avadice. I removed my gallbladder 2 years ago, but I still can't eat nuts or fried food. I was also diagnosed with fatty liver before the gallbladder was removed. Right. So the thing is, yes, once you remove the gallbladder, processing fatty foods can be difficult because you don't have a store for bile, even though you're still making bile. So we usually ask individuals to cut back on that. If you're diagnosed fatty liver before, definitely you need to look at things like your metabolic profile. You want to assess the fat. So as I said, even though an ultrasound can show you fat, it won't show you inflammation or scarring. It won't show you, you need to do some blood tests, you need to do a liver scan specifically to assess the amount of fat if you have fatty liver, to get a true picture and to see what your actual risk fat profile is, because fat can progress similar to fat from other causes and cause issues. So you need to get the liver scanned. Having hepatitis A in the past will cause scarring not to heal or get worse. Hepatitis A is one of the viruses that can cause inflammation in the liver. The thing about hepatitis A is that it is completely reversible, so it does not cause scarring or cirrhosis, unlike hepatitis B and C. So if you have hepatitis A in the past, you're not going to get scarring at all. It will completely heal, or it can go very severe and cause liver failure. But there's no chronic hepatitis A, only chronic hepatitis B and C. Can you tell us about the use of milk thistle in treatment of NAFLD? Yes, so definitely, Javid. So milk thistle, generally speaking, for individuals who have chronic liver disease of many different causes, we have what we call anecdotal evidence to support the use of milk thistle. Unfortunately, for fatty liver, there's no data looking at milk thistle, even though I would support its use in individuals who have severe fatty liver. So if your blood test, for example, or if you have significant inflammation, you can use milk thistle, even though there's no robust evidence for it. There's certainly nothing showing that it's detrimental, and it may be helpful, but the evidence is just not there. Vitamin D definitely does not have a role to play in the management of fatty liver, so I would not use vitamin D at all. Would you recommend doing a follow-up ultrasound in a year or two after the initial diagnosis of fatty liver to see if it's progressed? Right, so the ultrasound, what I would say is ultrasound is not a good test is not sensitive enough, I would say that if you did an ultrasound showing fat in the liver, you need to do a liver scan, a specific fibro scan, to look at the amount of fat and to be able to determine if there is progression or regression. So that's how you want to do your follow-up. An ultrasound would not be, I mean, ultrasound could show you that it's normal, that's true, but it wouldn't give you any detail in terms of how much fat is there and if there's scarring in particular. Is there an indication of how long it will take for scarring to occur if there's no intervention? Yes. So as I said, the progression is slow, but you can actually look for scarring by doing a scan, or if it's very severe, sometimes blood tests can show some complications, but you can know that by doing testing. As recently diagnosed with fatty liver, my weight was 191, now 176. Could this cause a different reading if I do another scan now? Yes, it can cause another, it can cause show improvement with that weight loss that you described, Valerie, but you should do a liver scan and not just an ultrasound, because the ultrasound may not be sensitive enough to show the improvement that you're looking for. Vitamin D, no role there. Eating oatmeal, can that help to get fatty liver down, Charmaine? Yes, definitely. Eating oatmeal helps in your metabolic profile generally, so that will definitely help, but you definitely want to cut back on eating high calorie foods as well, so not just eating oatmeal, but substituting the other things that you were eating before for the oatmeal definitely will help. Just to clarify, for those patients with fatty liver who progress to cirrhosis, is it possible to reverse the process, or do they progress similarly? Right, so to clarify, if you have fatty liver without scarring, then it's possible to reverse the process completely to normal. Similarly, if you have cirrhosis, you cannot reverse cirrhosis at this stage of our medical advancement. So you want to prevent cirrhosis. Okay, so before the scarring, you can reverse that if you take steps. But with the cirrhosis, unfortunately, scar tissue is just something we can't deal with, and that's where the complications arise. What would be the best way to mark or test for the improvement in the health of the liver? Right, so the best way would be to combine the following things. So you want to talk to the doctor first of all, get a general story. You want to do some blood tests to look for the severity of inflammation. So there's some liver enzymes that blood tests will show. And then an ultrasound to look for some other things which can also cause liver issues. And then a fibroscan to assess specifically for fatty liver to see what the amount of fat is and whether there's any scarring associated with it. So all those things together will give you the absolute best picture of your liver health. Can a person who has been cured of hepatitis C and has developed some scarring reverse some of the damage done by applying the methods? Okay, so if you have hepatitis C and you're cured of hepatitis C, then definitely, depending on what stage you were cured at, so if there was cirrhosis already, then unfortunately you're still at risk for progression. If it was before cirrhosis, then yes, you can have improvement back to normal depending on the stage. By applying the general methods, you can have further improvement because hepatitis C is one of those viruses which is associated with fat and liver as well. There's a similar process to improving fat generally, so you can definitely get improvements just by applying those methods for hepatitis C. On ultrasound, if there are signs of fatty liver and you have abnormal liver function tests, would the diagnosis be NASH? Yes, if you have an ultrasound which only shows fatty liver, nothing else happening, and you have abnormal liver function tests which show inflammation, it could be NASH once you rule out other things. So there are other things that can cause hepatitis. NASH is just one of them. There are viruses or autoimmune conditions, medications, other conditions which can also cause a similar picture. So it's not enough to just rely on an ultrasound reading on the blood test. There must be some assessment behind it and to look for other things which may also be responsible. But if all of that is negative, then it would be enough to suggest that this is NASH. And then you want to now decide if there is scarring associated with it to get a further idea as to how severe it is, and then be able to manage it from there. I'm not seeing any other questions at the moment. So we do have a few minutes before the end of the webinar, but again, I'd like to thank everyone for attending, and I hope it has been useful for you, the information presented. Fatty liver is something which, as I said, is becoming more and more recognized as a problem worldwide, and our population with high incidence of diabetes, obesity in particular, we expect that fatty liver is something that we will come across, and we do want to pay attention to this condition. Where am I located? Okay, so I'll put back the website information. It's actually at 2 Phoenix Avenue, which is beside Andrews Memorial in Kingston, Unit 8. And I'll just put the office number for you.